Good afternoon, Mrs. Fletcher. My name is Dr. Skouros. I'm a consultant at this unit. Your GP has referred you to my clinic. Would you please be kind to tell me what the problems are?
Well, it's been difficult. I've been feeling very low in mood.
Did anything happen, or did this come out of the blue?
Yes, it was more or less sudden, especially since I lost my job.
Would I ask you, did you enjoy your job, or were there any issues with your job?
I had been finding it increasingly difficult, really, to deal with my workload.
And how long have you been feeling this way?
4 or 5 weeks.
And other than feeling low in your mood, are you still able to enjoy your activities as before?
I used to enjoy going to the gym or going out with friends from work. It's been a huge effort lately. I don't really get any enjoyment from anything these days.
Could you kind of help me and talk me through your typical day?
I get myself ready, get the girls ready, drop them off, go to work, if I'm going to work, pick them up after work, get food ready for them before they go to bed. It's all been a really big struggle last few weeks. Even though I've not needed to go to work, it's still a big struggle, big struggle.
Sorry to hear that. Has your sleep been affected in any way?
Yeah, sleep's difficult. I used to get like 7 or 8 hours a night. Now sometimes 2 or 3 hours. And I'm tired in the morning.
I see. And how about your appetite? How your appetite has been recently?
It's been a struggle to eat most days. If it wasn't for my mum keeping a close eye, making sure that me and the kids eat, pretty sure I'd go for days without eating. I just can't seem to eat.
Miss Fletcher, you just mentioned the kids and their eating. Are they getting enough food every day?
Oh yeah, the kids are fine. And my rock. Even until my last day, I would make sure that the kids were properly looked after. It's lucky my mum's close by, she helps out a bit.
Very good of her, very nice of her. And how is your concentration and attention?
I just can't seem to focus or concentrate on anything much these days.
And what type of things do you feel you have been struggling to concentrate on?
Watching the TV to reading.
As you mentioned, watching TV, are you able to follow the programs and understand them?
Well, you know, I used to enjoy watching soaps, but I've been struggling recently to follow these. You know, the plots, they seem odd. Even though my mum and the kids, they explain what's happening to me. It seems odd.
Okay, when you have been well, what type of activities did you used to enjoy?
I was very active. I enjoyed running, watching EastEnders, reading.
Okay. And you described you used to enjoy these activities. Does this imply that you don't anymore?
It's a bit strange, really. They were my escape from like the daily grind.
Miss Fletcher, are there any abnormal thoughts that keep coming into your mind that you cannot explain?
I often feel I'm already dead. Everything's finished for me. I just feel like everything's just pointless. And that I really just cannot see a way past this present situation.
How do you explain being dead and being able to speak as you do now?
Well, I know because whilst I am able to speak, my insides are already rotten. And that's why I can't eat anything, because I'll just be more unwell.
Do you feel other people are also dead in the same way?
No, just me.
Miss Fletcher, have you had any thoughts of life not being worth living?
Yeah. I've often thought, just end it. Everything just feels worthless. I cannot see a way out of this current situation.
I mean, have you had any thoughts of how you might end it?
I just go somewhere in the car with a hose where no one can find me.
And have you actually thought about where and when this may happen?
I thought that if I continue to feel like this, I'll do it at the end of this week.
Have you thought about doing something like this before, or have you done something like this before?
I once took an overdose. Wasn't successful. But this time I would really want to finish it. And I'm hoping to do it well. Unless things improve.
How do you see the future for you, Mrs. Fletcher?
This feels like the end for me. It's the worst this ever been for me.
I'd like to ask you about your memory, how your memory is those days.
Shocking. I can't remember where I've left the keys. Reading, I have to reread pages, chapters I've already read. So it's like my mind, it's like a sieve. Nothing sticks. That's it.
I will try to test your memory a little bit. I will give you a full address. I would like you to repeat this address just after me, and later on, about a minute later, I'm going to ask you again to repeat this address. Is this okay? So it's Harry Barnes, 73 Orchard Close, Kingsbridge, Devon.
Harry Barnes, 73 Orchard Close, Kingsbridge, Devon.
Very good. Can I ask you what day is it today?
Thursday.
Good. And what is the date today?
23rd.
Very good, thank you. Miss Fletcher, can you remember the address I gave you a few minutes ago?
Harry Barnes, 23 Orchard drive. No.
Okay, it's Harry Barnes, 73, Orchard Close, Kingsbridge, in Devon. It's okay, it's okay. Can you please say the months of the year backwards, if possible, starting from December?
December. No, I'm sorry, I can't do that.
Okay. Can you spell world backwards?
World.
Yes.
W. W. W.
Mrs. Fletcher, what do you think is wrong with you?
Sometimes I recognise things that happened to my mum when she was depressed. And then other times I just think I'm losing my mind.
If your treatment required you to take some medication and engage in a form of talking therapy, would you consider this?
Definitely. I really don't want to feel like this anymore. And I just want to stop being a burden to everyone, like my partner. He's suffered enough.
Mrs. Fletcher is a 35-year-old woman who presented with low mood for the last 4 to 5 weeks. She was cooperative during the interview with poor eye contact, slightly slouched posture, and twiddled her thumbs during most of the interview. Rapport was relatively easy to establish. Her speech was slow, labored, and monotonous. She subjectively felt low in mood and appeared objectively subdued and low in mood. She had nihilistic delusions about being dead and rotting inside, which was preventing her from eating properly. She was well orientated into time and place and person and displayed poor concentration and attention. She was unable to say months of year backwards or spell world backwards. Her memory was poor as she struggled to recall a given address completely after 1 minute. She, however, had a good insight into her illness and was keen to have treatment.